Every 11 seconds, a girl is mutilated, and every day, 200 of those mutilated die due to female genital mutilation, otherwise known as female circumcision. Regions which practice female circumcision include 28 countries from Africa, northern Saudi Arabia, Turkey, Syria, and southern Jordan. What is female genital mutilation? According to the World Health Organization, female genital mutilation is the total or partial removal of the clitoris. There are 4 different types of female genital mutilation. Type 1, which is the removal of the clitoral hood. Type 2, which is the partial or total removal of the clitoris and inner labia. Type 3, also known as infibulation, and this is the removal of external genitalia. Type 4, which includes all other harmful procedures to the female genitalia for non-medical reasons, for example, pricking and piercing. But why do people practice circumcision? According to some community, female circumcision is done to control women's sexuality, that is, to ensure virginity before and fidelity after marriage, to increase male sexual pleasure. 2. It is considered part of a girl's initiation to womanhood. 3. To some communities, the external genitalia is considered dirty and ugly and removed to promote hygiene. 4. It's a religious requirement. And 5. Circumcision is a prerequisite for marriages in some communities. The procedure, which is usually carried out without anesthesia, has immediate and late complications. Some of the effects are bleeding to death, urinary infections, infertility, complicated pregnancy, increased risk of childbirth, use of unsterile equipment could also lead to HIV and hepatitis. Due to all the negative effects and the practice being outdated, I personally believe that female genital mutilation should be abolished. So how can we stop female genital mutilation? First of all, we should educate the community on the effects of female genital mutilation. Second, we should enforce laws which ban FGM. And lastly, we should provide a guidance for health system, that is, to develop training materials and guidelines for health professionals to help treat and counsel women who have undergone the procedure.
Genital circumcision, and what are the different types? So female genital circumcision is the actual suturing of the opening to the vagina. There's practice in several cultures around the world. Some of them are abolished, or the actual procedure now is abolished in a lot of the countries, but although it is abolished, it still continues to happen. Culturally, they believe, they meaning people in the culture, their belief is that female should be circumcised. That way that preserves their virginity to the time that they're getting married. So why do I think it is practiced in some cultures? And I think it's practiced because that is a way to preserve, at least in a male, sometimes it's male dominated, and to ensure that the male that the female person they're marrying is indeed a virgin and has not been touched, and that's very important in their culture. Would you advocate for it? Why or why not in some of the cultures? If you're having a full understanding of what the female genital circumcision is, it would be difficult to advocate because from a public health perspective, it's not healthy in most cases. Some females have had it and they're fine, but in most cases they're at a higher risk for infection. So from a public health perspective, it would be difficult to advocate. From a general perspective, then it would be you might want to, well, even from a public health perspective, you might want to think about the culture and work within that culture to, if they are going to continue to do this practice, what are the things they need to do to keep the female safe from infection. It seems a little bit extreme, so from a personal standpoint, I would probably say I wouldn't advocate for it. I would advocate that the female has a choice whether they want to have this happen, this procedure performed on them. So But again, cultures are cultures, and you got to respect the culture. However, from, like I said, public health perspective, this is difficult because it does present a lot of problems for the female, particularly at that young age, where I would have a very difficult time advocating. What do you think should be done to those who practice it? I think in countries where it's been abolished and they continue to do it without the consent of the parent, if it's just a male making that decision, I think the mom needs to be there also. But if it's been abolished, I think that there should be consequences, because the reason it's been abolished is because it puts the female at a higher risk for a lot of infections. So I think there should be consequences if it is indeed abolished in that country. What those are, I don't know. I mean, that certainly should be some policies in place for that. What happens to someone here in the United States or a country where it's certainly not allowed? What happens if someone is found to be circumcised, or even that procedure done here? Obviously, here there's mechanisms in place where you would, depending on the age of the female, I mean, Child Protective Services would be involved, public health would be involved, probably Adult Protective Services would be involved. So I think that there would be a whole 3 or 4 different agencies involved to make sure that the female that has been performed on has her rights protected in terms of this country. And if they want to continue to have that procedure, or that existing procedure. But I think here it's a little different, because most people will not advocate for it here, simply because it's performed on children. So I think it would be, I think Child Protective Service would be involved, and then the child would probably be taken into custody, again, respecting the culture, and I've been on one case where that actually happened, and there was Child Protective Services was involved, Adult Services was involved, public health was involved in terms of treating, particularly if a female refuses the treatment. In this case, they needed the treatment. So in the end, she was treated, and she decided that she would still keep the circumcision in respect to her culture, and we respected that, and but we did treat her. Okay.
You're not alone, together we stand. I'll be by your side, you know I'll take your hand. When it gets cold and it feels like the end, there's no place to go, you know I won't give in. No, I won't give in.